Hi, I'm Barb Poppy. I served as Executive Director of the U.S. Interagency Council on Homelessness from 2009 to 2014. And since then, I've been working across the country with communities to better address homelessness.
Hi, I'm Matthew Doherty, and I also had the honor and privilege of serving as Executive Director of USICH from 2015 to 2019. And some of you may have heard a little bit about how that ended. But in any case, starting earlier this year, I've been working as a consultant, and one of my projects has been helping to develop the framework for an equitable COVID-19 homelessness response. Both Barb and I are also working with a new partnership of national organizations and experts to help communities implement the framework and to navigate their responses to the intersecting crises of COVID-19 and homelessness. And these partners have now created an at-a-glance matrix to help guide how communities prioritize their use of CARES Act resources.
The at-a-glance matrix builds on the equitable framework, and it provides a guide to help communities maximize resources and use them wisely. The needs are very great during these challenging times, but we believe that smart planning and execution will help more families, individuals, and communities emerge from the pandemic even stronger. By using the framework and the at-a-glance matrix, you will be more effective and efficient by sequencing the investments into each potential intervention and to optimize resources in ways that will focus on, first, advancing racial justice and equity. Both homelessness and the pandemic have shone a light on racial and economic inequities in our nation. So CARES Act funds should help eliminate disparities in communities, not exacerbate them. It's also really important to address the highest needs first. People who are unsheltered, who are older, disabled, medically fragile, literally homeless, and extremely low income should be helped first. And finally, we know that getting people into housing works. The best health intervention for homelessness is stable housing.
Policymakers in communities across the country have a powerful opportunity to put these very principles into action as they make decisions regarding how to use new funding appropriated through the CARES Act, including ESGCV, CDBGCV, and the Coronavirus Relief Fund. We absolutely recognize how challenging responding to COVID-19 has been for already stretched homelessness response systems, and we know how many competing demands leaders are facing every single day. But to have the greatest impact on reducing homelessness and on advancing racial justice and equity, these funds must be used strategically and wisely. The specific priorities for each community will vary by the status of the COVID-19 pandemic in the area, the availability of other resources, and the scale of unsheltered homelessness. Today, we want to talk about narrowing your priorities to focus on the most important interventions and the best uses of these funding sources.
Before I headed USICH, I worked in Columbus, Ohio with local decision makers as the COC lead. And I know firsthand how hard it is to navigate amongst competing priorities and scarce resources in politically choppy waters. We created the at-a-glance matrix to help local policymakers navigate more easily by prioritizing among the potential uses of CARES Act funding for interventions into different essential strategic interventions to best meet and address the needs of people experiencing homelessness amid the COVID-19 pandemic. Our global recommendation is that across all of the potential interventions, communities should be prioritizing people who are at risk of COVID ahead of other households.
The at-a-glance matrix is organized around a set of questions that will help you sequence and optimize these new federal funding streams. The matrix provides two scenarios within which decisions need to be made. If your community has a high rate of unsheltered homelessness, or if your community has a relatively low rate of unsheltered homelessness. The matrix then prompts you to consider what interventions are needed and then which funding sources you should use to help pay for those interventions.
If your community has high rates of unsheltered homelessness, your priority must first be on protecting the health and well-being of people experiencing homelessness during this pandemic. You'll want to determine if you need to stand up and sustain non-congregate emergency shelters that support deconcentration of existing shelters in accordance with the CDC guidelines, and also to be able to provide safe sheltering opportunities to people who are unsheltered and living on your streets. If possible, purchase hotels or other properties to expand the supply of non-congregate shelter, affordable rental housing, and permanent supportive housing. And if existing outreach is inadequate, outreach and other supports for people in unsheltered locations following the CDC guidelines should be focused on efforts to rehouse these individuals and provide them help to maintain hygiene, food, and PPE. Once you've met these priorities, your community can then focus CARES Act resources on other activities.
If your community has a relatively low rate of unsheltered homelessness, or if your community has already successfully addressed the priorities that Barb just described, then you should focus CARES Act resources on rapid rehousing or other exits to housing for people who are at high risk of poor health outcomes due to COVID-19 per CDC guidelines. Funding permitting, you can support exits from homelessness for lower risk people, and you might also dedicate resources to expanding diversion efforts to help households avoid entry into homelessness, and also to targeted homelessness prevention efforts for formerly homeless people who may be at highest risk of losing their housing. That includes people who are participating in or who recently exited rapid rehousing programs, or people who are currently living in permanent supportive housing, but who may now be struggling to pay their share of costs.
Once your community has achieved the objectives that Matthew has laid out, then begin tackling targeted homelessness prevention for extremely low-income households who are at high risk of homelessness or who reside in neighborhoods that experience high rates of entry into homelessness. As you do this work, try to use non-homelessness specific resources for these efforts. And further, continue to prioritize high-risk people ahead of other households and focus on providing equitable access and achieving equitable outcomes.
With COVID-19 infection rates varying over time, the relative priorities for interventions should be carefully monitored and reconsidered to prevent people from becoming infected with the virus and to reduce mortality risks, which we know are higher for people experiencing homelessness. For example, if infection rates are increasing, a higher prioritization on investments into sustaining or expanding non-congregate shelter may need to be considered. And just as you need to sequence the interventions, you should also sequence and optimize the funding. The matrix uses a simple 1, 2, 3 scale to walk you through the optimal sequencing for using the different funding sources. 1 equals consider using these funds first, 2 equals then consider using these funds, and 3 equals then consider using these funds if needed.
To operate and acquire non-congregate shelter sites like hotels and motels, maximize reimbursement through the FEMA Public Assistance Program, and use coronavirus relief funds, also known as CRF, since the amount of these funds is far greater than the very limited ESG and CDBG CV funds. CRF is time limited, so costs will need to be incurred by December 30th, 2020, and FEMA public assistance is subject to FEMA authorization and approval of expenses. Some communities, though, may need to dedicate some part of ESG and CDBG for emergency response during this public health crisis. But having these funds available primarily for rehousing during the economic recovery will be more optimal. During the initial rehousing phase, continue to prioritize CRF for short-term rapid rehousing, diversion, and targeted homelessness prevention for formerly homeless people. Then use ESG and CDBG. As we close out this conversation, I'm wondering, Matthew, if you have some additional advice for communities.
So there is one issue that's definitely keeping me up at night, and I'm sure that's keeping other people up too. The economic effects of this pandemic will mean that many households will be at risk of eviction, perhaps more than your community has ever experienced before. And this will be happening at the very same time you are working to protect people who are currently experiencing homelessness and you are working to end people's homelessness. Your communities and your leaders should absolutely be concerned about these families and about the racially inequitable impact of evictions. Unfortunately, though, even with the infusion of resources into the ESG program and other programs, the scale of homelessness-specific resources is likely nowhere near the expected scale of need of families facing evictions. And it remains very difficult to predict which households will enter homelessness as a result of an eviction. So these are difficult and painful choices, following upon other difficult choices you and your partners have already had to make. But our best advice is still that homelessness-specific resources, like ESGCV, should be prioritized for families and individuals who are already experiencing homelessness or who are at the very greatest risk of entering homelessness. And we can make sure together that we are advancing toward racial justice through efforts to support those populations. But then on top of that, we need to identify other funding sources to address the current and looming eviction crisis. And to that end, we all need to advocate for more federal resources that can help prevent evictions for families and individuals who are facing that crisis. And that includes resources that need to be a part of the next stimulus bill that comes out of Congress. And what will be included in that next bill is literally being negotiated as we record this video.
Thank you, Matthew. I wholeheartedly agree that to meet so many needs, additional resources are desperately needed. The suggestions we offer today through the at-a-glance matrix are to prioritize the scarce resources we have available to meet the most pressing needs. We hope these ideas will help more families, individuals, and communities emerge from the pandemic even stronger. Thank you for your time today and listening to our recommendations.